Hello and welcome back to ONSALUS Health. Today, we will discuss 5 reasons why you may experience itchiness after ejaculating. The itchiness that occurs after ejaculation is typically associated with sexually transmitted diseases, urinary tract infections, or inflammation of the prostate. In such a situation, it is important to visit a urologist for a thorough evaluation of your case. This assessment will help determine the diagnosis and identify the appropriate treatment. The most common causes of itchiness are: Number 1. Lower urinary tract infections, also known as UTIs. Lower urinary tract infections are caused by bacterial agents that enter the bladder and urethra. The most common microorganism responsible for this infection is Escherichia coli. These infections are common in men over 50 years old, especially those at risk of prostatic hyperplasia. However, they can also be caused by various factors such as an anatomical issue in the urinary tract, hormonal changes, certain behaviors, high sexual activity, and underlying conditions like diabetes, kidney stones, among others. Symptoms of lower urinary tract infections include painful and burning sensation during urination, mild fever, and sometimes itching after ejaculation. How to treat it? Treatment for urinary tract infections involves the use of antibiotics. The specialist will prescribe the appropriate antibiotics after identifying the specific bacteria that is causing the infection. Typically, antibiotics are taken for 7 days, but the duration may be longer if necessary. Number 2. Trichomoniasis. Trichomoniasis is a common sexually transmitted disease caused by a parasite called Trichomonas. It is transmitted through unprotected sexual activity and can be found in semen and pre-ejaculatory fluid. This parasite can easily infect the penis, vulva, bladder, and urethra. Men with trichomoniasis often experience discomfort during sexual intercourse, stinging after ejaculation, irritation, and a burning sensation when urinating. How to treat it? Specific antibiotics are used to treat this disease, as determined by the specialist. These antibiotics are typically taken orally in 1 or multiple doses. It is crucial for both partners to undergo the same treatment to prevent reinfection. During the treatment period, it is important to abstain from sexual intercourse. After being cured, it is advisable to use protection during future sexual encounters. Number 3. Nongonococcal Urethritis, also known as NGU. Urethritis is an infection of the urethra, the tube through which urine passes from the bladder out through the penis. It can be caused by various microorganisms, but the most common cause is the bacteria Chlamydia, which is usually contracted through unprotected sexual intercourse. This infection is commonly found in sexually active men between the ages of 15 and 30, particularly those with multiple sexual partners. When infected, men often experience pain, burning, and stinging during and after sexual intercourse, fever, and occasionally a discharge of pus-like fluid. How to treat it? The treatment aims to eliminate the specific pathogen causing the infection and prevent its spread to other parts of the body. The attending physician typically recommends taking antibiotics and non-steroidal anti-inflammatory drugs. It is crucial for both partners to receive the same treatment and abstain from sexual activity until the infection has completely cleared. If this video has been helpful in resolving your concerns, please consider supporting the channel by giving a super thanks. Your contribution is greatly appreciated. Number 4. Chlamydia. Chlamydia is another common sexually transmitted disease caused by a bacterial infection. It primarily affects young, sexually active men between the ages of 15 and 24 who engage in unprotected sex. Men with this condition may experience a burning sensation when urinating, itching around the opening of the penis, and itching after ejaculation. It is crucial to promptly and appropriately treat chlamydia to prevent complications such as urethral infections and testicular inflammation. How to treat it? Chlamydia is treated with antibiotics. The recommended treatment duration is 7 days as prescribed by the specialist. During the treatment period, individuals should refrain from sexual activity. It is also important for the partner to receive treatment to prevent reinfection. Number 5. Prostatitis. Prostatitis refers to the inflammation of the prostate gland, which can be caused by a bacterial infection originating in the urethra or bladder. It commonly presents symptoms such as pain during urination, discomfort in the pelvic area and genitals, pain during ejaculation, frequent urge to urinate, fever, and chills. How to treat it? When prostatitis is caused by a bacterial infection, it is treated with antibiotics, taken orally for a duration of 4 weeks. The treating physician may also recommend anti-inflammatory medications and fever reducers every 8 hours. Well, that's it for today. Thank you for watching. Don't forget to give us a thumbs up and feel free to share any questions or suggestions you may have in the comments section below. We appreciate your support and see you next time.